I'm Jill, and I'm from Spokane, Washington. And a couple years ago, actually 2.5 years ago, in March of 2002, I was diagnosed with late-stage ovarian cancer at Sonovive Medical Institute. And since then, it's been a long road of a combination of alternative and conventional treatments. And I've been to the Sonovive Medical Institute on a number of occasions, and they've helped me in a number of different ways. It really is a life-changing experience when you go through their program. Getting close to 2.5 years since my original diagnosis. At the time, the doctors in the States gave me a 20 to 30% chance of being alive in 5 years. The first oncologist that I met with spoke about all the pros, meaning that I had not had any prior health problems, and I was young and fairly strong, and he thought that I would fare much better than the statistics. But then he went on to say, but I wouldn't expect you to be around by the time I retired. And I said, oh, really? Do you want to make a bet on that? I had to call him on it the next day, and I just let him know, I don't think I can work with you based on what you said yesterday. And I'm not going to live my life based on statistics. And that's the kind of hope that I feel that you get when you go to Sonovive. Every time I leave there, I leave with a renewed sense of hope that the numbers aren't going to mandate whether or not the cancer that was in my body is going to get me or not. When I was originally diagnosed, the cancer was staged at 3C, which is one step away from stage 4, which is worst case scenario. So it hadn't spread to my lungs yet, but it had gone to quite a few other places. And when they actually did the debulking surgery, they weren't able to get all the cancer out. They were able to get out about 75%, which this is in the States with a standard gynecological oncologist, very well trained in what she does. And after that, I went through very aggressive chemotherapy with mainline therapy, which is 2 drugs, carboplatin and Taxol. And 6 months of that, lost all my hair, eyebrows, eyelashes, looked like an alien. It was very, very hard. And after 8 months of being off the chemotherapy, and I was just getting my hair back and just starting to bounce back from the chemotherapy, I went in for a checkup, and my surgeon came in and said, I've looked at your scans and I'm concerned. And the cancer had returned to my lymph nodes. And so at that point in time, I got on the phone with Sonovive and scheduled time to go back down, and had been told about their ability to do what is called specific transfer factor, where they go in and they take a sample of the tumor tissue and they actually make a vaccine specific to the tumor in your body. And so that was done for me, and I was at Sonovive for 2 weeks and went home and started on the transfer factor vaccine. And before I started my chemotherapy that they wanted me to do in conjunction with the vaccine, I had another scan. So I'd had a scan in May, a scan in late July, and there was like a decrease in the size of the tumor. It was small, but there was a decrease, and without any conventional treatment, that was usually unheard of. So I know the vaccine had something to do with that, because the diet I hadn't been on long enough to affect a change. And so that really gave me a lot of hope and belief in that transfer factor vaccine. And so that's something that I can order and reuse as time goes on. It helps helps my body to work with my immune system. It helps my immune system to target the cancer. Right now the cancer appears to be in remission, yay, praise God. And I had returned to Sonovive again over the summer after finishing some radiation and low-dose chemotherapy, where they had targeted just that area where the lymph nodes were. And we'll see, what happens from here. The University of Pittsburgh has had some great studies of using the combination of IMRT radiation and low-dose chemo, where they forced ovarian cancer into remission for several years. So I'm hoping with that information, and then with what I'm doing from what I've learned down at Sonovive Medical Institute, that maybe we can affect a change forever. And so that's what I'm always hoping and believing for. I just loathe hospitals in the States. And so I chose to have some surgeries at Sonovive that I could have had in the U.S. The facilities are very clean, and there's nothing like having your nurses pray with you and sing to you before and after your surgery. It's just a special, they just take extra special care of you. if somebody's looking at cancer or any type of degenerative disease, I would say run, don't walk, and just get down there. It will change your life. It will make a difference. Preventing disease is so much easier than having to face the battle that I'm facing. And if you can spend a few $1,000s and figure out where you're at and where you should be 10 years earlier than sooner than later, then it's such a gift. And there's no value that you can put on life.